coming to the perfect storm track here today. My name is Dr. Tuzzolino. I want to be presented and really about this perfect, more about it, of course, as we get through all this. Just let you know that I am not a student. And the way I can kind of connect, like you see this types of things. So I see the stressors that you all are under, the families are under, and also to some of the common questions and challenges that you come across. So I hope today that we provide you with some valuable information to be able to take and put in your tool belt to be able to help you in your daily lives. And that's really the essence of what we're really going to be focusing on today. But I want to share a little bit about myself. Again, my name is Dr. Tuzzolino. I'm first and foremost a husband and a father. Went to Arizona State University, became a chiropractor. Now, I promise you today, we are not going to be talking about neck and back pain, okay? This is going to be a lot more in depth. It's more focused on a lot of the neurology and components on how we focus on kids with these neurodevelopmental challenges and help you understand a little bit more about it too, which, again, when I deal with parents, specifically those on the spectrum that have kids with autism, you've done your study, you've done all the things that you can do and understand this to the maximum. But I think with what we're going to talk about today as well, you've seen and studied this stuff, you just may not have seen it in this light, okay? And I am a pediatric and family chiropractor. I have a family-focused practice where I primarily like to focus my care on the little kiddos because this is where we have the biggest impact on their overall life, whether it be just a kiddo with no challenges or those with the most extreme challenges that come in through the office. But I also belong to the National Wellness Foundation, which all these talks that I give with this is really sponsored by them. It's just a resource. You can always look them up as well, but it's really to provide families more resources and information on how to help raise healthier kids and which results in healthier families, okay? So of which this is my wife. This is my wife, my little one, and she's 21 months old now. So she's not so little, but she's still little. But really, the reason why we do things is really about the why. So my why do I focus on families? Why do I focus on kids? And it's particularly, I've been in practice for 10 years. And I started out in practice more focused on a lot of the pain-based model, and as I've gone through, this has kind of drawn me over, and especially now having this little girl of mine, I want all parents and all kids to be able to have the start that she's going to be having, to be able to function at her fullest potential, function at your fullest potential, be able to have your kids function at their fullest potential. And it's not really about what we give them, but it's really helping build their function in their body from within, not from outside. With a lot of this stuff, but really the plan today is number one, to help you become aware of some of these things. Like I mentioned, you're very educated in a lot of this information. You just may not see it in a certain way. So awareness is very, very important to understand what's going on that's in front of us, because we can be standing in front of a tree but never see the forest. Sometimes we just need to take a step back and look at it a little bit differently to really see and be able to put things together in a light that can help us the most. Because if we just still stand in front of that tree, we'll never get out of the forest. So and again, answers for you. I know a lot of the answers and questions that go through your heads that I deal with a lot of parents, especially, is focused on these kiddos. What may happen to them later on? What can I do? How do I control certain challenges and outbursts and all these different things you come across on a day-to-day life of dealing with an autistic or a sensory challenged child, and hopefully give you some answers, and then also help provide you an action step to be able to help handle and tackle these things too. Fair enough? Okay, great. So I want to first start off by doing an awareness test. Okay, so when we watch this little quick video, what I'd like you to do is count how many times the team in white passes the basketball. Has anybody ever seen this video before? Okay, good.
This is an awareness test. How many passes does the team in white make?
Everybody good?
The answer is 13.
All right, 13. Good. But
did you see the moonwalking bear?
Anybody see it? Yeah. Keep looking. Right? So this is it. It's easy to miss something you're not looking for. Okay, like I said, this is stuff that you've probably seen, you just haven't seen the light. So this is where I'm gonna show it to you. Okay. So to really start off, I remember going back to childhood. Think back in childhood, right? What were like the two major rules that we were given in childhood? Don't call kids names, right? And don't do drugs, right? But today, how many names are there out there now that we give our kids? A lot of these labels. I don't remember. I mean, think about the school. I don't even know if I had, maybe one kid maybe had ADHD. One, there's so much more of these names now, right? And I'm in my practice, I don't name call. We don't use labels. We just, kids are kids, and that's who they are, right? Just like, I used to be a blonde hair, but I'm a bald person now. It's like, these are all different labels that we have, and these kids have names, and sometimes they hurt too. And then don't do drugs. Probably one of the biggest areas where there's a lot of drugs is the school nurse's office these days. Big dispensary, right? Because a lot with these names come along with a lot of these medications, and it's a contradiction in, don't do drugs, but, right? It can get confusing. So these are really the two rules I tend to try to follow as well. I continued on from my childhood, but not to now. But I find that today's day and age, in the mainstream medical model, they have become fantastic at diagnosing. I mean, it is over and over, right? We've become very, very fantastic at creating these labels and diagnosing. But the one thing that's really, I think, is missing the mark is really finding that underlying cause and addressing it and removing it when possible. And so this is, in my opinion, really, no matter what name you really call it, no matter what diagnosis there is, it's not one thing. There's not like one cause. It's a multifactorial condition, situation, factor that comes into play, and oftentimes they're related. And so when we bring this up, what are we talking about? We're talking about autism. We're talking about a lot of these sensory challenges, ODD, OCD, sensory processing, ADHD. These are really things that, and you may come to find too, and I find it in my practice, kids that have autism, they may have some of these other things as well. Who with ADHD may have some sort of the sensory processing. There's a lot of factors that come into play with all this. You'll get to understand what this is all about here, but really it comes down to these three things, what we call the 3 T's. And I'm going to zip kind of through this because this presentation is normally a 2-hour presentation. We're going to squeeze it in, so I'm going to really zip through some of this stuff. If any of you have any questions after, please just stop me. I'll be hanging around here to be able to answer any of that for you as well. I'll take the time. But I'm going to zip through this part here, but you'll understand we're not going to touch upon every single one of the things and examples of these, but this will give you more of an idea. So the first one is really, the first T is the traumas, physical stressors on the body. So what physical stressors can these little kiddos be under at an early age? Well, it really oftentimes starts off within in utero sometimes. Breech, transverse positioning, or multiples in uterine constraint, depending on labor, are they stuck in the canal? I mean, all these factors can come into play. One of the biggest underlying factors that I come across, that I see such an underlying common denominator in all these neurodevelopmental challenges, is birth trauma. And that meaning if there's been, commonly with forceps, vacuum, these rushed pregnancies, cord being wrapped around the neck, C-sections, emergency C-sections. Now, it can even happen in a natural delivery, but these are more of the common ones where we see a lot of these factors come into play, and you'll understand more, of course, as we get to them. But then, we get the childhood falls, all the different bouncy things and that these little kiddos can be under. And so here's a little quick video. I don't know if you've ever seen this from America's Funniest Videos, but this gives a little example of it. I used to think these videos were hilarious until I had a little kid. So these are really, kids fall, right? I mean, I got a 21-month-old. I remember seeing how many times she's fallen and things that happen to these kids. I'm not going to sit through all this because we all can touch upon this, but this is just an example of really some of these stressors that these kids are under. And oftentimes we don't look at them as a stressor. They're just thinking my kid fell. But these are things that happen. The next one is chemical stressors. So toxins, the second T. Chemical stressors, we're bombarded each and every day, more and more that we've come across. And I've seen it since I was a kid to now. I mean, you can talk about all these different things that we're under now and how things have changed, even with the food that we eat. You can get into a lot of the GMO. Now we have to have organic. It's got to be labeled. Like our food has to be labeled. Shouldn't the food that's not real be labeled? It's kind of twisted, but I mean, we've got household environmental things, which I'm sure you've probably dove into, trying to remove different things from diets and different toxins, stressors, because it's all about the toxic load. It's not just one thing. And we even get into whatever side you are on the vaccine controversy or debate as well. But there's ingredients in it that's not supposed to be in the body, which is considered to be by the body a toxin. So there's a lot that these little kiddos are under that their bodies are being built. We are too. So I mean, this is not just talking about our kids as well. So this is what anybody in our practice. It's all about this stuff too. But we tend to find little kiddos as they're developing, they're more sensitive. So the third one is the thoughts. So what stress could a kid be under, right? I mean, they're kids. They're just living and playing, but it all starts in pregnancy, right? Because baby's nervous system is mom's nervous system tied together. They're really interacted. You're pretty much almost like one, right? Your food is their food. It's very intertwined. You'll learn more about really how stress affects the nervous system and how it relates to, especially in these earlier stages, on how it can pre-wire a kid to be more prone to fire and be under stress. You can learn to be in a stress mode. And then you get into that forceful, stressful deliveries, NICU stays, the high stress life, all these different things these little kiddos can be under, like we talked about the diagnosing, because as they get more aware, they know they're being told different things, they're called different things, they're different than other kids. It can create stress and of course bullying and challenges that come across a lot of these little kids because they're different, and a lot of the stresses that come along too. So again, it's not just these kids, it's everybody. Parents deal with a lot of this as well. So what is this perfect storm? This perfect storm is that multifactorial of these three T's, because these three T's, when we live in it, which we do, we live in a stressful environment, they can create interference, irritation, and inflammation, which cause a condition what we call in the chiropractic realm a subluxation. Now, some of these words, I'm going to tell you, you're going to hear some nerdy words. And I'm a pretty nerdy guy because I like research and I like diving into it, but I tend to make things a little bit easier at times. And if I'm going through this too and there's something that like, hey, I don't get it, we're in an intimate setting, you can ask a question too. I may kind of defer to the end because I'm going to get to it, but if you have some, feel free to kind of ask me if I don't clarify it for you, because I don't want you to kind of be left behind as well, okay? So this subluxation is one of the things that we come across, which we'll get to and really talk about. But I want to lead you through, in my practice and dealing with a lot of families with these challenges, there's kind of like a generalization of a pattern I tend to find and see, and it may correlate and you may resonate with it, you may not. What I find is this is kind of like a trickle effect that I tend to see with a lot of cases that I come across. First and foremost, the start of pregnancy, right? It all happened in the beginning. And we don't have to get into how it happened, but it happened, right? Two cells come together, they make this human being. But when that diagnosis comes, or when you peed on the stick, right? You got that little plus sign, whatnot. What'd you have to do next? Had to go to the doctor so that they can actually diagnose you as being pregnant, because you had to get that definite reason that you were pregnant. So then what happens? Well, we got to run this test and we got to do this thing and we got to get this imaging and we got to do this, right? And then you have the baby shower. And what is the most common gift given at the shower? What's that book that every new mom gets? What to expect when expecting, right? Probably one of the best Stephen King novels of all time, right? I mean, because it's going through every single thing that can go wrong, right? And so creating this stressful environment, can this happen to me? Can this happen in my pregnancy? Is this going to happen, right? So it's going from what it used to be, pregnancy, this fantastic journey and experience, becoming so structured now, and in this medical model of really being a stress state. It creates a lot of stress now because there's so many things and structures that we feel we need to do, and of course being exposed to some of these things that can go wrong. It can create that stressful environment where you think about this can start that seed of stress. To where now, stress, when your body's under stress, your body's in a state of fight or flight, it's in a state of survival. So what happens when you're under labor and you're in stress? Does it happen real easy and quickly? Oftentimes no, right? It's labor, it's long-term, because your body's like, you're under stress, you can't get this kid out now. So what happens oftentimes now, it's a lot of fear and intervention based, where there's Pitocin given because the baby's not coming out, we got to speed this process up. Now with Pitocin, what does that do? Those contractions, I'll never feel it, goodness. But that, if any of you have ever experienced it, and what I've heard, the most excruciating muscle contractions that you can ever experience, because it's forcing the body to be speeding us along. Pain gets so much, and then what happens? I need an epidural, right? Epidural now comes into play. This can have an effect as far as how the body integrates and feels things, and this process can be slowed down even more. Or what can happen? It can help have an effect on the baby. Heart rate goes down. What do we need to do? We got to get you in emergency C-section, get this little kid out ASAP. Stress on the little kiddo. Now, stress on this little kiddo, which I see oftentimes too, which we'll get to a study that kind of shows why. But these kiddos, let's say if they had to get this little kid out real quick, this is the only chiropractic part I'll talk about, they can have a little kink in the neck. And if they can't turn comfortably, are they going to breastfeed? No, I'm not going to breastfeed. I can't do it. I'm not latching. It's not comfortable for me. So then what happens? Baby's not eating. We got to do formula. Most formulas, the number one ingredient, sugar. This can stress, of course, a GI tract, can create a lot of colic, difficulty sleeping. You see where this is kind of trickling along? I don't know if it's following with anybody, but with this too, 80% of our immune system is in our gut. Our gut is affected. How's it going to affect our immune system? Kid can get sick more often. Ear infections can kick in. If ear infections kick in, commonly they happen over and over. What do they give the kiddos now with ear infections? Not now, what do they always do? Antibiotics. What does antibiotics do to the gut? Kills it off, kills off every bacteria. What does that do to the immune system? Down. Each and every round, more and more down. If they use prednisone, down. More and more insult and injury and effect on the immune system. Impacting these little kiddos, more and more antibiotics, more and more stress on these little kiddos. And then there's a whole other realm of things that can occur there, but then we get that toxic effect, right? Toxic food environment. You throw in a little bit of Cheetos, Doritos, and those sorts of things, right? And then now they're getting about 3 to 4 times more vaccinations than what we got as kids. A lot of bombardment and stress on these little kiddos. So understanding really the chiropractic part, again, it's not about neck and back pain that we're going to be discussing today. Very much more of nerve doctors, in essence, because the nervous system is the master control system of the body. Brain controls and coordinates everything, and your body, really the essence of what the nervous system does, it's there to perceive the environment and then to control and coordinate every cell, tissue, and organ as a response to it. That's basically it, and it is the first system to develop within ourselves, because it needs to be there to control and coordinate every aspect that goes on. So this neural development is so important because it's, number one, the first system to develop, and it helps develop all the other systems that come into play. That was actually by Dr. Bruce Lipton, if anybody has ever heard of him, but he studies epigenetics, how lifestyle affects genes. It's not so much the genes anymore, it's how lifestyle has affected them. So really, you have some of these handouts in your packets as well that you'll be able to take home. But again, the nervous system, you can think about the nervous system like looking at this one. It's like looking at the circuit breaker in your house. Each level goes to different parts, right? Kitchen, bedroom, whatnot. Different levels go to different parts, digestive tract, heart, lungs, all these different areas. This one on the right, so what happens with those 3 T's that occur, stress on the body, right? So your body is either in a state of stress or health and recovery. Can't be in both at the same time. It's going to be one or the other. So it's okay to be under stress as long as the body can recover and get back to health and healing and be in that balance. So what happens early, if we get under stress, right, and we get more things that stress the body, more importantly, the nervous system, Stress in the nervous system kind of tips this more into that, what we call that sympathetic, which is that, you think of it as like a gas pedal. It's just that go, go. We've all felt it before, right? We're under stress. We're just go, go, go. It's survival. We're there to just survive the next minute, to get to that nice, happy place to where then we can calm down. But if we have more and more of these things bombarding the body, causing this to tip more in this area, the nerves that fire together, they wire together. That's why they say practice makes perfect. It becomes easier and easier to do things. It's just like when you probably drove here this morning, you probably didn't think about every single thing that you did, right? It became more of a neurologic habit. And stress can become a neurologic habit. And so if we get more stuck in this sympathetic mode, this survival mode, during developmental stage, we don't develop as well and as efficiently and as best as we can, because we're not in that state of health and healing. So this is really this impact of this 3 T's affecting this subluxation that can affect these stress areas. So if any one of these areas are affected, it can stress where it goes to. So quickly getting through that, we're going to get to the nerdy part. Okay, so we have these 3 T's that cause this subluxation. Okay, so what this subluxation really is, there are areas within the nervous system that there has been, especially the reason why as a chiropractor we focus on the neck and the back is because it's like your circuit breaker. We're looking at really the first point you can have an impact on the central nervous system and the peripheral nervous system at this one point. And so what the body will do is, when in a state of stress, just like us, we're trying to get away from the stress, right? We're trying to adapt and move. The body will do similar things. And that's what these little misalignments can do. But what they can do also is create that interference, right? Remember that kind of little circle thing we had in the beginning, that subluxation? It can affect, create inflammation, irritation, and really this interference along this communication highway. That's the way you can think about it, is this subluxation is just an interference between the brain and the body. So we'll explain this a little bit more, and it's broken down to the 4 Ds, okay? These words you don't have to remember. I will say them, they are nerdy, but it's dyskinesia, disapprobation, dysautonomia, and dyskinesis. I'll explain to you really what they are. So this dyskinesia, if you ever thought about chiropractic and what most people think about and what most chiropractors will focus on and deal with, is this part right here. This is the rusty hinge, it's the misalignment, but the important about it is the misalignment that gets stuck. Think about that rusty hinge, just doesn't move fluidly, doesn't function the best that it should, and it can affect it and surrounding that area. And so if there's inflammation in the surrounding area, especially if there's nerves that help things work the right way, it can interfere with what's occurring there. And that's how it deals a lot with a lot of this pain part. But there's more to your nervous system than just pain, like we talked about. I mean, it's controlling every aspect of it. So the part about this, so it starts at this point here, from those 3 T's causing this dyskinesia, okay? And so kind of looking at this, the biggest part I want you to focus on, and as we talk about this, it can happen in any joint in our body. The most important ones are the spine, which you'll see why in a moment, but particularly this upper neck area. This is going to be the most important part I want you to really focus on, to think about as we're going through this as well, is this upper neck. Because what affects here, we're talking about brainstem, we're talking about a lot of sensory information that comes through here. You can think of it as like the air traffic controller, this point right here, because everything in the body, between the brain and the body, go through here. Okay, it's kind of like the filtration system right there. Everything's got to pass there. So this is probably this is the most important area of our body and our spine. So this real pandemic, there's that Dr. Gottfried Gutmann, or Gutmann, I should say, he's German, studied 1,000 infants. And so in his practice, what he did is study these infants, and 80% of these little kiddos, he studied them right after birth. And what he found was that he found this interference occurring. There's this dyskinesia, this imbalance that's occurring there, and he called it the KISS syndrome. So really what this is it's called kinematic imbalance suboccipital strain. So basically, that misalignment to that upper neck area that created that strain. Okay, but what he found there as well, it had an impact on motor development and manual control. But as we get to seeing in the future research too, is how it's going to affect even upper processing centers as well. But it also affected as far as interfering with the neurologic and immune function. which is going to be very interesting in what we look at too, as far as what occurs into this neck area that has such an impact on our gut and our immune system and inflammation as well. It's really within the last couple of years of these things that we're looking at here. So some of the research that we look at too, I find, in my opinion, is not wrong. It's just incomplete. They're just kind of just off like a step, which I'll show you where that is. But what he said is, he said that this area, for the real function to be improved upon, he said every child should be checked for this because it happens in about 80% of kids, of those kids that he researched of this 1,000, but it needs to be corrected because it's that vital as far as in their function and development.
I have a quick question.
Yes.
Is it something that ever corrects itself, or would they just grow up with this?
Yep, some kids, it can correct itself. And that's where there's, of course, not as much study done, of course, right now. And who knows how long it would take and who it is. So it's one of those things that, you know, you can wait and see if it does, or if we want to get to it.
And we would never know because they have no way to tell us.
They don't check. Right. It's not, it's in most cases not being checked. Yeah. So I'm going to show, all right, so this is going to be a graphic video. I'm going to fair warn you, it's a video of a C-section. Okay. The reason why I'm going to show this is because I don't know if many of you have seen it, but it's going to kind of give a real good example of what can happen during a C-section. But I also want you to hear the doctors talking as well. So even if you're not watching, just listen. Okay.
Here's a girl. Here's a girl. Make it cute for the camera. Oh, yes.
Okay. So you see where they're grabbing? You see just the relaxed nature. This is just like another C-section, right? It's just ho hum. Just, you know, doctors whistling. I mean, probably does a number of daily. But right then and there, that could be the South area have, particularly as it relates to even some of your challenges we get to here. And the reason why this too, as far as why I touch upon it, is because we're seeing this number of C-sections is going up and skyrocketing. And why? I was just like, why? Why aren't we asking why? Right? Is it just because it's a easier fashion? Is it because there is more stress in moms' lives to where now they need to go this route to where the body's just not naturally going? Because back in 1970, it was 5.5%. It's now 32, and this is in 2008. This is 32%. I mean, some hospitals are even 40, 50%. But I think Scottsdale Shea is like 33 or 34%. It's very common in the 30s throughout the valley. So why is this happening? And if we know it's happening at this rate, how many kids are being born like this? And how many of these kids are being checked? And how is this going to affect down the line for these little kiddos? So here's one of the latest research that I've come across. So this is really affecting the cerebellum and sensitive periods with autism. So we're looking at here the effects of the cerebellum, which is really, it's located, which you all may know and may have come across this, but the cerebellum is right above the brainstem in the back lower portion, kind of like where Doc's hands are here. And so what they're finding, and that's where these sensitive periods of development are crucial, because we can develop these subluxations, and if they happen later on in life or past these developmental stages, of course we pass through that development and we're good. But they're associating these areas as really impacting these little kiddos, and especially early on it happens, it can affect their overall development. And particularly with the cerebellum, is what was thought as the cerebellum was more just about motor and coordination. But what they're finding as see this actual affects of the brain, especially especially the cortex. And so this area, especially with a lot of the area where they're looking, what is it, the challenge in the brain, what is it, it's the prefrontal cortex, but what is possibly affecting interacts and relates to that development of that region of the brain. So this is what is called diesesis. And so I know it's hard for me to say, but really basically what this is a shock. It's really a shock through point, sudden loss or change in the function, really in the portion of the brain that really connects these two areas. So I mean, it can be this shock, like if you looked at that C-section or any of these more forceful types of, it could be that moment to where it creates this injury to occur and this disruption, this interference to start to occur, that it affects, this starts before this sensitive period where it can have an effect on that development of that area. So really it creates this distortion and disruption of this communication. So if the brain can't really communicate well, of course it can't develop as well as it should, and that's where this interference really comes into play. It doesn't have to be a block off. It's just like if you're talking on the phone and they're static, there's a disruption or distortion in the communication. If you're talking to someone who's cooking your meal that night, you may not get what you get. So this communication is so important between the brain and the body. So really the end result you get is really this injury that can occur there. And so this is the part that kind of bringing about where I feel that they're just that one step off, because what they were looking at here is really when that cerebellum was affected, injury. This is up to the thalamus, which goes to other areas associated with the cortex. What's feeding the cerebellum? It's all the other sensory information that's coming from the spine in. That's that one area, right? That's that main breaker is right in that area. And so what if there is this syndrome, this KISS effect, this kink, this whatever you want to call it, occurring there that's not allowing this sensory signals to come in and feed that part of the brain? And then where does it go from there? If the cerebellum can't function the way it should, how is it affecting the areas above and beyond that? And so creating this, I'm going to show you how we come down now, because that sensory information coming into the cerebellum is so important, is what we're going to talk about here. This is the disafferentation. But you can think about this part. Afferents are things that are coming in, that are affecting. So you can think about this as all the signals coming in to the brain. And so when we talk about this, think about it, you know, this input will control the output, because the brain needs input to perceive the environment. So think about what's going on and then process and react to it, which will be the output. So we've all heard of the 5 senses, right? Anybody hear that there's actually 7? All that, you know, the taste, see, movement sense, and balance and coordination, which is that cerebellum, right? But the movement sense, this is all coming from every single other joint in your body. It's what's called, it's your ability to, like, if you close your eyes and raise your arm, you know that arm is up, not because you see it, but your brain is talking to those senses. But what happens when that area gets kinked, it's what's called gate theory. You can have proprioception and nociceptors. Nociceptors actually compete. So if you have more proprioceptors, nociceptors will stay down. But if you're kinked, you're not getting those proprioceptors, so what can come about? Nociceptors. Nociceptors you could think about as being loud noise. You could think about proprioceptors like classical jazz, and you think about nociceptors like Metallica, heavy metal, distracting, right? So if you think about, really, we're doing stuff that I would hate to do. Really complicated math problem, right? Going how to be able to get that problem solved. And let's say you do it in a matter of constrained time. Process information. So this proprioception here, it's like, this proprioception to the brain is like, it's like a battery. It charges it. That's why people, when they exercise and move, how are their moods, right? They're up, energy, they're kind of moving around. And how about people that are just kind of stuck and sitting in the chair? How is their moods, right? They're low energy. part about this, 60% of those signals come from the spine. This is why the spine is so important. It's not just a structure that really protects this central nervous system. It's a living, breathing organism. It is helping really supply these signals to the brain. It's important to move it. And the big one here, 33% of those signals, air traffic controller from the upper neck, feeding that brain. So if we're missing 33% of that because there's this kink, misalignment, whatever you want to call it, occurring there, minimizing that along with any other areas that may be affected. Think about the processing, the charging of the brain, the sensory input that this brain needs to really develop and move and function the way it should, on how that can affect it. So again, this little area, very small area, especially in a little kiddo, such a big impact. So there's that gate theory, is just talking about proprioception goes down from that joint being kinked, that rusty hinge. So if that gets kinked and it's not moving, can't send the good signals, bad ones go up. And so those nociceptors can create pain, but the big part about it is sending those sensors, that information to the brain to help charge it and function, help it function well. So a way to think about really when we're talking about those 3 T's, this is a great chart. You have, I believe you have this one in your amp as well. But again, this is like looking at your RPM meter in your car. And so T's can add a little bit more footing on that gas pedal that revs that RPM up. And again, the more this comes in, the more this can rev it up. And it may not be, I think I just might have that balance there, but I can get this to you guys if you like. But this really starts to rev this up. So now thinking about if they're under stress, a lot of these T's coming in and RPM is staying stuck up there. Remember that the nerves that fire together, they wire together. And if we get wired to be, where it can create a lot of disorganization and challenges on this brain. So this one's going to freak you guys out, but don't look at the screen just because there's so much going on. But basically, when we're talking about here, the next step is what's called this dysautonomia. Really, the autonomy means this the autonomic nervous system. It's the nervous system that controls, again, those cells, tissues, and organs. But when we break it down to especially these other systems, because again, if this part of the nervous system is in a state of that fight or flight, stress mode, it's not in growth and development, this is where we can see other challenges occur. So like when we're talking about this autonomic nervous system here, sorry about that, but that should say immune system. It's just being cut off there. But here, if the immune system is being affected, like from what we talked about before, but even to this neurologic effect, now you're getting ear infection, strep throat, eczema, all these things that can come into play because the immune system is just not firing. Then we talk about the digestive system as well. And if that's not being level, we can get constipation, colic, reflux, all these digestional things that can come into play as well. And then you talk about endocrine system, hormone system, chemical imbalances. This is where we with kids like this understand what's going on in the body, and it's producing this chemical imbalance because it's not every region to just stress and anxiety about the hippocampus, which really gets to the learning. So again, when we talk about this stuff, it's multifactorial, right? It's not just one, it all builds on itself. It's an algorithm. They're different ingredients. Just like if we gave all you the same ingredients for a lasagna, we'd end up with lasagna. They're all going to taste different, and they're all going to be made differently. But we end up with the same label. But all these systems are controlled through this as well. Oh, and one other area too, when we're talking about the gut, I don't want to miss this, that's why I put it in red. Not only does it affect the immune system, but they call it the second brain. Has anybody ever heard? Second brain is for a reason. Ready to do stuff in the gut. So a lot of people that get under some of these SSRIs, the serotonin or serotonin reuptake inhibitors, it's trying to do is just keep the serotonin there. But if your gut's off, again, why is it occurring, right? What if their guts just off, not producing about 80% of the serotonin that's supposed to be produced in the body? Here is a big one. All right, this is a huge part that this is so new that you may not even heard about it, but it's called the vagal nerve. This is gonna, I feel this is gonna be one of those things that shifts a lot of healthcare in the future. Is this one particular area, and with this was in Scientific America, but what they were looking at here is, and what they've shown is how this vagal nerve, what the vagus nerve is a big sensory nerve. It's one of the cranial nerves, but it's one that actually exits the cranial vault. But what it impacts so many different organic systems in the body, particularly the digestive tract and the upper 2/3 of the digestive tract. What they found is if this vagal nerve, which is mostly sensory, bringing input into the brain, if it's not functioning the way it should be, inflammation can go up in the body. And that's where this whole gut and brain connection comes into play. It's what's called parasympathetic. You can think of it as like the brake pedal. That's the health and healing part. It's not the fight or flight. So if we're not getting the sensory input in the brain, and we're either on the gas pedal or brake, and we're starting to lose our brake, what's going to hit? Gas pedal goes away. So it can release control of this body on a neurological level to be, again, leaning more towards that fight or flight. What happens when we're fight or flight? We don't develop and grow the way we should. It's more survival. And what they're finding here is that it modulates inflammation of the body as well. And so what they've been doing and what they're coming up with is a unit to implant. It's electrical, stimulate the nerve. What I do each and every day is stimulate the vagus nerve with this. Because where does it come? This is the vagus nerve right here. What areas can be affected here and all throughout? Again, how important this upper neck area is, not only with that kink and misalignment kiss syndrome, but especially with this vagus nerve. Because I just recently saw two just the other day, and I didn't have time, but they actually did I think it was mice, and they cut the vagus nerve, and they showed how much more likely these mice were to have, if they had them had cancer, and they cut the vagal nerves in these mice, how much more metastasis occurred in the ones that had their vagal nerve cut. So I mean, great inflammation, they've shown that inflammation is really one of the underlying causes of cancer, so really allowing it to just flourish if this single nerve is not functioning the way it should be and at its best. And then this one just touches upon, especially how we talked about the antibiotics, if the immune system is affected, how many bouts and doses of antibiotics can occur, which can cause this pediatric dysbiosis, which is an imbalance in the gut flora, which is the gut bacteria, and how it relates to disease. And we're showing, of course, how the more of this imbalance in the gut flora has been associated with even more conditions and disease associated with these little kids to talk about. And we're getting close to the end here, but this is it's defined really as a reversible physiologic state consistent of unnoticed, misdirected neurophysiological reactions to various agents. Now, really basically what that is are those three T's. Talking about those environmental events, the body station. But this is, remember that input, those afferents? This is the output. So it's errors because of the interference from the brain out to the body. And if we have errors, miscommunication, signals not going out well, the body doesn't function well, right? It comes out in different ways. So we see this as far as how the energy coming out from imbalance. Three categories that I classify in our practice. We kind of break it down to the combo, the drunken rainbow kid. Where the anxiety, a lot of these higher sensitive components. The drunken bull kid are more of these sensory processing because it's more of like the brain is disorganized, right? Like a drunk person would be, right? They're disorganized. The senses that are coming in, they can't just put them in the proper places, so they just kind of seem all over the place. They can't focus. These are more of the sensory processors, sensory processing disorders, the ADD, because they just can't focus. They're just all over, but they don't have the hyperactivity. And then some of these kids have challenges with balance and coordination too. The drunken raging bull, which is a combination of the two, which is usually classic like autism, which is classic like epilepsy and seizure. Yes.
Say for siblings, could that cause both ADHD and autism in one or the other?
As far as what
Siblings, like
siblings?
brother and sister, or brother or whatever. Could that cause something with both?
Oh, all
Something
this?
different? Yeah.
Oh yeah, because again, this can affect even us. I mean, it can affect any kiddo. It can affect twins in different ways. I mean, we've had some. I just had a patient the other day. One had dealing with ADHD and other sensory challenges. So she was the one that was transverse position, and her sister was sitting on her the whole pregnancy. So talk about in-uterine constraint and stress starting from the get-go, along with the challenge in birth and everything else that came along after. So no wonder and no correlation that this one that had the challenge and stress that was positioned in that position could be affected, but it can affect everybody. Yeah, and it doesn't matter at what time too. It's just important, of course, the earlier it affects us, the more it can impact us. So that's really kind of how, just kind of break down and summarize to make it a little bit easier to understand, are really how we classify these situations here. So I want to show you a story of Evan here. And Evan is a 3-year-old who was diagnosed with autism.
See you later. Oh, no? Fun? Yes? Yes? Do you love Aunt Kristen? Say yes. Adults, your boots.
He was a perfect storm case where kind of the classic, like what we went through, challenge, labor, birth, and led to the other cascade of and so they had the neurologist. Was just able to follow most in July. Started the care with him, and so this is kind of for, you know, of course every kid responds differently, and I want to make this note too. In the care that we give autism, I don't treat ADHD, you know, treat those labels or conditions. We just care the body and help it function better. And some of the time, all of the responses, some are different. They're all different. Everybody responds differently. But this is Evan's case here. And so what happened with him after his first adjustment in the car, he fell asleep from 4 p.m. to 7 a.m. First time ever in his 3 years that he's, especially for that long. began talking more within days, started to imitate or kind of associate and play more with his brothers and sisters, starting to see more life out of him, started pooping a lot. Now we're re-engaging brain gut, detoxing, fever was coming on as well. This is all within this first 2 weeks. After the first 2 months, totally different kid, speaking full sentences, speech and development, behaviors better, potty training, a lot of these things that just improved greatly right away. And so this is after 2 months.
Little bird. What's that one?
Goody.
What is it? A dog?
Yes, yeah.
Yep.
can talk.
A truck?
That's the other part of it.
Mhm.
What?
That's that truck. One. Oh, this one. What's this one?
Use the assess the nervous system in the office. So like on his, so on his here, really we see really is over from the first one to the second one to the third one. And as you can see here, like in that second one on the left here, just the colors that are get over to that, we're clearing out that upper neck, and now it's focused digestion. Now it's all GI right into there. We're tracking progress this, which is awesome just to be able to see what's coming from their body, especially with, in his case too, in any case that we do, to be able to utilize this technology to be able to help along with that. And so this is him.
Hey,
after 10
smiley
months.
boy. What do you have?
Hi, Donna. Evan.
Yeah, your name's Evan. And how old are you going to be, Evan?
What?
When are you going to be 4?
On July 17th.
Oh, yay. What do you have on your face?
I have dimples.
You have dimples.
I have dimples. I know how to use them.
So there's hope. I mean, there's, oftentimes we may get to the point to been through everything. It's sometimes lose hope, and especially being under the stresses, it's understandable to kind of get to that point too. And not to say that chiropractic is the end all be all, but it's an option that's there for a lot of parents that don't even know it's an option. And it's an area too, I think you may even think about, you weren't even exposed or even knew and connected how this can really interplay with little kiddos as well. Especially when we're talking about getting to the underlying cause, right? Because you can do a lot of the dietary stuff, you can do a lot of the behavioral exercises and OT therapies and PT therapies, and they can work great. But if we're not getting and removing some of that interference that's occurring, they just may not be getting to that full potential that these little kiddos can get to. And that's where, if you do have some of these questions that may be going through your head, can my kiddo be this, or does my kiddo really have this interference that's occurring? What we're doing really for you guys today and for this weekend seminar is provide an opportunity to help get those answers or the questions answered. And really, I get a lot of people that come up to me and ask me questions after, and really the biggest and best answer I can really give oftentimes is really, I don't know. We'd have to check and see. And normally we do this check and evaluation in our office. It's normally $295. What are for you guys that for $100? And that $100 is for a full evaluation, which is really can be done in 2 different ways. One way, which is often common with a lot of cases, we do a phone consult first because you're everywhere. Your schedule is off where you do a phone consult to make it easier for you to go through. It's more CSI agent. Really find something about it or forgot about. start from. You get a better picture on what's going on. And the second step would be to set up an evaluation with the little kiddo that takes about 15, 20 minutes, sometimes 30 minutes, just based on the little kiddo and how interactive they are. But what we it's just an instrument, just reads information. One of the parts, we just kind of click a little instrument up their spine. It's two little pads, place at different places. That first one, but really, be able to sit down with the case and then evaluate to really see if there is anything that we can actually do. And then set up the third appointment where we sit down and go over. And I lay it out in front of you, let you something we can get after. Now, this is not the worst case scenario out some of the course, but for the first member, you can have each and every member of your family for 200. So that means if you have 3 kids or whoever you want to get checked, just for that we collect, we're giving back to the Arizona Autism Coalition. So it's just really to cover our costs is really what we're doing, but then donating the other aspect of 50% back to the coalition because they are doing a great thing, providing resources for parents in this community. And if you are interested, you don't need to know your schedule. There, consult, or if you do have time, it's a 2-day process. We do the consult, but I like with the autistic scenarios to do more of that 3-day because it makes it easier for you guys. But they'll give you a call. You just give them payment over the phone, and then they can get it taken care of everything there for you. It's just easy for you. Okay. So I hope that this brought you some insight, a little bit maybe of a different view, awareness, maybe just some. And again, I'm going to stick around a little bit if any of you have any questions you'd like to ask me. I know it's lunchtime. I went just a little over. Sorry about that, cutting in 7 minutes. But thank you for taking the time. Thank you for not falling asleep and paying attention here. So I enjoy the rest of it. Appreciate it.
Thank you.
Absolutely.